Good afternoon. I'm Dana Serrano. I'm the founder of Gait Mechanics Therapy Services, and I am thrilled to be here today with Dr. Alice Brumley. She's the director of the Lewis and Anne Green FAU Memory and Wellness Center. And joining her today is Dr. Stephanie Gomez, one of the fantastic nurse practitioners there at FAU Memory and Wellness Center. Welcome, both of you.
Thank
Thank
you.
you. Thank you for having us.
Yes,
Thank you
thank
for
you for having
joining us
me.
today. They are part of our fantastic community partners that support our community of patients that have mobility and memory disorders. And today we're going to spend a little time with them to get a little more information, not only on the testing process, but the supportive services that exist at FAU Memory and Wellness Center and debunk some of the scary concerns that people have, the myths and the legends regarding the testing process for our loved ones and possibly for ourselves. Thank you again. So I am going to start with just some basic questions with you guys. I know we have a lot of people who are interested in your services, and I, for one, can say that every patient that has gone through the FAU Center, whether it's for testing or supportive care, you guys are amazing and really have made such a difference in this community. And I love what you do. And I think it's so important for our audience or our community to know exactly what's out there for them and their families. So I'd love to get a little bit of an idea if you both can explain what your services encompass, and we can go from there.
Yeah, absolutely. So I'll get us started on that. Thank you again so much for this opportunity. And it's we're very much community minded, and we want to be there in any way possible that we can for those in the community, especially when they're dealing with changes related to memory or cognition, potentially with a dementia diagnosis. Not only do we provide an array of services to those individuals that are affected, but to the whole family, because we know that there's a lot involved in these types of changes. And as we get older and our risk for developing dementia does go up. So it's really important to be as proactive as possible in both learning how can you keep your brain healthy and aging healthy, and then what can you do to prepare if you are facing a dementia diagnosis. And what can you do, for your family members, because a lot of them will end up taking on the role of a caregiver. So we have a lot of services here, some of which are covered by insurance, and then some of which are no cost, supported by various grants that we have through the state and federal government. So I'm going to kind of go through a list of some of those services. I'll start off with talking about our comprehensive memory and wellness evaluation. This is where we do the memory testing, and it is a three-part process where you first begin in meeting with one of our fantastic nurse practitioners like Dr. Gomez, and you will do a very comprehensive intake looking at what are your specific complaints, what are you experiencing, and that the Dr. Gomez is going to go a little bit more into that later. What medications are you on? What is your medical history? What are your family history? There's a lot of components that we look at: social history, your diet, your exercise, what is your daily life like? And we really collect all of this information and then determine the appropriateness for the neuropsych testing, which we will get more into details on that component. And then find that evaluation wraps up with a visit with the nurse practitioner again to go over the results and findings. And you will receive a very comprehensive care plan that's developed by our entire team, which is an interdisciplinary team composed of the nurse practitioners, the neuropsychologists, and social workers, and more. So we really try to look at this from every avenue and give you the best recommendations available, which often includes many community partners and resources that are available in the community, like the cognitive rehabilitation services with Gait Mechanics, which we're definitely a big fan. We've seen
Mhm.
amazing results in our patient population when they go through and obtain these services, oftentimes which are covered by your insurance. So we try to encourage, use your resources. This is why you have the insurance. So it's really important to be as proactive as possible in maintaining your brain health. Some of the other services that we do offer driving evaluations, and this is going to be ordered by your doctor. So we would get a referral from your community provider. We also have an adult daycare program here where it is ACA certified as a specialized Alzheimer's disease and related dementias adult day center. We have activities going on throughout the whole day to stimulate you cognitively, socially, physically. We do chair yoga, chair aerobics. We have art programming, live musical performances, animal therapy, you name it. We have a lot going on over at the Adult Day program. Very exciting. We also have many no-cost services through our various grants, one of which is one-on-one caregiver coaching through the REACH program. And this is a fantastic opportunity right now where individuals who are caring for a loved one with dementia can have that one-on-one individualized coaching to help with behavioral symptom management. So that's been a tremendous program. We also have home visits case management for people who are specifically living in Broward County. And then we're doing specialized training for providers in the community who are working with the intellectual and developmental disability community who are at a higher risk for developing dementia. We also offer psychotherapy. Our licensed clinical social worker, Sarah, who's just absolutely fantastic. She leads many of the support groups and meets with a lot of the caregivers. She also offers individualized psychotherapy, which is covered through the insurance as well. And then we have many research opportunities. We have a lot of ongoing support for our caregivers. This includes 4 weekly caregiver support groups that are each tailored to specific subgroups. We have 1 that's in person and 3 that are online, making it easy access, having a lot of options for, all of everybody's needs, and really obtaining that support we've seen tremendous results in that, because when you step into that caregiver role, it can oftentimes be very isolating. So it's important to connect with others who are going through a similar experience. Did I miss anything?
I think we touched on everything.
Yeah.
Yeah.
So, and then, we constantly have a revolving door of new programs going on. We have a lot of students that come through here for learning opportunities. So we have a lot going on at the center, always trying to offer educational seminars to the community, similar to what Gate Mechanics does. So, lots of activity.
Really a tremendous amount of services. And so what I'm getting from this is not just how fantastic you guys do your job and make sure that there's supportive care there, but the fact that it's not just a center for testing. And I think that's where a lot of people have really not recognized all of the services that can be utilized. So I guess the next question that I would have is, how would someone identify the need, either in themselves or others, to go forward and contact someone from the center? I know there's a lot of gray area as far as when to reach out for help, and oftentimes we are more reactive than proactive. So I'd love to hear your point on that.
Yeah, so we believe that the sooner that you come and get evaluated, the better for the long-term results, right? Because we have all these services that we can provide, not just the patients, but the caregivers, support services, community services. All of these together are going to help when it comes to the long-term results of these cognitive deficits that many of these patients may be having. And so through research, it's shown that starting earlier than later is going to help improve the long-term results of these. So usually we want you to come in when there's specific warning signs, right? So there's many different warning signs that can occur. For example, memory changes that can disrupt your daily life, repeating questions. Usually the caregiver notices these changes where they have to repeat questions very frequently, or they notice that their loved ones are misplacing items very frequently, missing appointments, or having a hard time keeping track of appointments, having a hard time with day-to-day things, whether that's problem solving or word finding, having trouble recalling specific words that they want to say, or being able to organize their lives properly. Also, we see social withdrawal with a lot of our patients. So changes with that, especially let's say they enjoyed 4 more activities before and now they're withdrawing and they're not enjoying those anymore because they've noticed changes in their cognition, and they're afraid to go out in their community because other people may judge them, or they may be talking about them and say, oh, look, so and so is being more forgetful. Also, driving concerns, if they've noticed that they've had more issues with confusion while driving or not recognizing familiar places while driving. Emotional changes are also a big one. So more depression, more anxiety, all of these cognitive changes can increase those emotional changes as well. And so it's good once those warning signs do come up, or those, if the caregiver does notice those signs coming up a little bit more frequently, it's good to come in and get tested and get evaluated, because the neuropsych testing will give us what seems to be more subjective and a more objective view of it through testing. So a lot of times, let's say some of our patients come in and say, you know, I've had trouble with like executive functioning skills at home. Our neuropsych testing will specifically see if there are actual deficits that are significant in the executive functioning skills. And so we're able to correlate, you know, what they're saying with actual data written, and that can be very beneficial because early detection will ensure that we're giving them these resources and these things to make sure that they implement things in their daily life that can improve. One of the resources that we like to use, like we said, is the gait mechanics resource. And I think that's great because you guys go in and help them with these things as well: word finding, executive function, problem solving skills. And so the sooner that you notice these signs, the better it is for the long term of the patient.
That's great. And I think what you brought up really highlights a lot of what we do as well, in the respect that most people would think of early onset of memory loss as the first thing that is really the identifying factor. However, that
Yeah.
can be easily masked. It can be emotional. It can be social withdrawal. Those are the symptoms and the things that I think we are so much better as a community understanding
Yeah.
and identifying and pulling out. And that is such a huge piece of that. Our goal too is, as we bring in our OT team to look at organization and management of their life and those sort of things, we are finding that those are sometimes the very first thing, and memory loss is maybe not quite the
Right.
only factor, or maybe the factor that's really stressing them out as a first identification. So I
Yeah.
love that you brought that to light.
Yeah, and
So,
oftentimes I just
sorry.
wanted to mention about it. It is very common for the individual not to recognize some of these
Right.
more subtle changes. And so
Right.
really, I encourage you, if you're watching this video, to, trust your loved ones or trust your providers who might be noticing these subtle changes. And, it's worth the time and the effort to go through with the testing, at least at the minimum, to get a baseline. That way,
Yeah.
if there's any changes down the road, we have a better understanding of
Yeah.
what we're starting with. And so, just because that is oftentimes something that comes up in those initial visits, is
Yeah.
them themselves may not recognize it, but your loved ones, they're doing this because they care about you, and they're pointing this out because they want you to get the help that you might need.
Yeah,
Right.
and that's why we usually ask that family come in for
Mm-hmm.
the visits,
Mm-hmm.
because they can provide further insight into maybe smaller things that the patient hasn't noticed, that they have noticed because they live with them. They're there day to day.
Mm-hmm.
And so, yeah, it's very important.
Great points. I love that. I think that's so important to clarify those things. So, what would be the next initial step if someone or their loved one needs to go through the process and get some initial testing done? What would be the first step for them doing that? Would they contact their doctor? Should they contact you?
So there's multiple avenues in which you can go about obtaining the care. Directly, you can just contact us right away. You do not need a doctor's referral in order to go through the testing, because you will initially meet with one of our nurse practitioners. So you can come in as a self-referral. So you would just call our main line, which I'm sure will be provided along with this video. And but just in case, it's 561-297-0502. And one of our clinic assistants will be able to assist you in getting the appropriate information, running your insurance. We always check the insurance beforehand so that there's no surprises about any cost affiliated. If your insurance doesn't cover it, or if you don't have insurance, fear not, please still contact us because we do have many opportunities for subsidy or scholarship in order to cover those necessary services. And that's through the generous support of donors in the community and our other community partners like Boca Raton Regional Hospital. And otherwise, you can definitely speak with your provider, speak with your physician, your nurse practitioner, either your primary care, your neurologist, or even we have several endocrinologists. We have many specialists that would directly refer to us as well. And they can also send us your information along with a referral and what the underlying concern might be. So there's multiple avenues to go about doing that. But if you want to speak directly to us and ask more questions, I definitely recommend picking up the phone and somebody will be in touch with you.
Fantastic. That's great advice. I love it. So I guess the question that a lot of people would have after they go through testing is the what now question. I've gone through testing. Maybe the diagnosis is anxiety. Maybe the diagnosis is I have some mild cognitive impairment. Regardless of those diagnostics, what would be the next step and what supportive services at FAU would there be provided to myself or my family to take next steps in combating whatever I'm dealing with?
Right. Like Alice mentioned earlier, we do have several sessions for the evaluation. And so the first session, like she said, is with the nurse practitioner. We do medical history, we do a small assessment on them. And then the second session is the neuropsych testing that we mentioned. The follow-up session, which would be our third session, is back with the nurse practitioner, like myself. And in this session, it's a feedback session. So and recommendations. And so I go over what the diagnosis is at that point, what deficits we saw during the testing, and then what recommendations we have moving forward. We collaborate with a lot of partners. Like I mentioned, Gait Mechanics is one of them, through your Brain Boost program, your Memory and Motion program. So we definitely refer a lot of our patients to you guys. And then also we want to make sure that if some of these patients are not being seen by a neurologist, that they are being followed by a neurologist. And so we refer them to one of our local neurologist offices like FEMA Brain Health. We also collaborate with the care team. So if there are patients that we see, maybe we need to discuss significant findings with their providers or need to communicate something that's very urgent, we do collaborate with their team, with their care team to make sure that those things are being managed appropriately. As far as internally, we do offer psychotherapy with our licensed clinical social worker. We do, like Alice mentioned, we offer the caregiver support groups. So we have that as well. And that caregiver support group is at no cost to the caregivers. We also have the Adult Day Center, which we refer a lot of our patients to that are in that stage of their life that they may need that additional support. And we provide driving recommendations. Like Alice mentioned, we have the driving evaluations done here, and we also provide them with support. So if we are recommending that they don't drive, we provide them with local resources like the Palm Trans services, where they are able to coordinate those services when we're recommending that they don't drive. As far as like educational resources, we also put them in contact with the FAU OLLI program where they can join some educational classes, seminars for brain stimulation. So we try to provide as much information and resources as possible so that they can stimulate as many parts of their brain as possible. And so that encompasses pretty much the majority of what we go through in that post-testing phase. And obviously, if there's any questions that they have, or if there's any that we go through so much information that a lot of times maybe they need additional visits or maybe additional information, we're very open to discussing any further information with them if needed in a different session, or they can call us for whatever services they need, and we're able to provide them with that.
That's great.
Yeah, a unique part of our process is that in between that neuropsych testing and the feedback visit, we do what we call a case conference where we
Yes.
meet with the entire interdisciplinary team. And so everybody comes together and we talk about the case in full detail, how and kind of what happened during the testing, what happened each of the visits, and what led us to a diagnosis. And then we develop the care plan together. So we
Hmm.
really try to be as thorough as possible in developing a unique, individualized care plan for that individual and their family. And so
Yes.
that, really, we pride ourselves on being as detailed and comprehensive as possible. And then, like Dr. Gomez said, sometimes things change, and we have people that come back after, maybe 6 months and follow up with us, and we may need to tweak the care plan based on changes or if there's any barriers. We
Mm-hmm.
definitely recommend that people reach back out to us. This is not you don't have
Hmm.
to, and because it's a results visit doesn't mean it's the ending point. We want to be a continual resource and support for you and your family. So if, for example, we try to refer to several neurologists in the community, sometimes it can be hard to get into some of those neurology clinics. So please reach out back to us, or they may not take your insurance. Reach back out to us and we can help to collaborate and get you what you need and on the right path for the right treatment.
Hmm.
That's great. I think that's very important for the community to understand that it is not just testing and support groups, it is a care plan. So it's
Yeah.
customized, it's developed to work with what the needs of that person are, and to basically handhold the family and the patient through the process and after the process to make sure they have the proper care and support they need. That is really amazing. And what a difference from, 20 years ago when just even the testing process was so new for neuropsych testing.
Mhm.
Really it's a fantastic way to go and really get some answers and to get the support. So I think the other question that a lot of people have that comes up quite often, at least with our patients, is
Mhm.
the concerns about labeling of dementia diagnosis, the privacy surrounding that, as well as what concerns that they might have, what adverse effects of going through the testing process, labeling, all of that. How can you squelch some of those concerns?
Yeah, so thank you for bringing that up. It's a very good point. To kind of begin with the confidentiality aspect, because certainly this is a very vulnerable process. We're diving deep into your life and your mind, and some people are nervous about what their family might think about maybe they're working. We have several people that come through here that are still working individuals, and our goal is not at all to remove you from the life that you're living. We want to make sure that we can get you the information necessary to help guide you towards the healthiest path. And sometimes that, sure, there's diagnoses that are quite uncomfortable to reveal, but we're here to support you and you're not alone in that. So we do definitely work with, based on your consent, whatever you as an individual feel comfortable us sharing with your family members, with your various providers, your care team. We encourage you to try to share and be open with your family, but sometimes it takes time to get there. So we will definitely respect what your wishes are and, go through this process as privately as you may need it or involve your family. So we very much include your wishes along every step of the way. So definitely we want to encourage, and we don't want that to be a barrier to going through this process and opening this door, is that we're going to maintain your wishes as best as possible, and making sure that you are safe all in all. It's very important. So that's definitely a big concern that many people might face in this process. I think another one is that testing can be quite scary or invasive, like I mentioned, and so we really try to the neuropsych testing is a paper and pencil type of testing. It's not on the computer. You're not locked up in a room by yourself. You are with one of our great testing team along the whole way. The neuropsych testing is a quite lengthy process. It can be about 3 hours of testing, but you are granted as many breaks as you'd like. You don't have to sit there the whole. You can take snack breaks. We have coffee, we have tea, we have restrooms, we have a comfortable library. If we really need to, we can break up the testing. So we really try to accommodate, everybody's needs. If you need to get up and walk around, it's no problem whatsoever. So, we don't want you to be intimidated by this testing because we've tried to make it as comfortable as possible.
I think another concern too that's very common is a lot of people not wanting to be labeled with the dementia diagnosis
Mhm.
or being afraid of being labeled with dementia. And what I would say is that pretty much knowledge is power, right? And so the earliest that you can detect any changes in your cognition, the better it's going to be for treatment options. And so through the neuropsych testing, we can determine are you in the normal aging range? Are you mild cognitively impaired, mild cognitive impairment, or is it a more serious condition like a dementia? And so knowing this can help the patient, empower the patient and families with information and resources to know, okay, what do I do now? Now that I know that this is what I have, what can I do to either try to remain where I am for the longest amount of time as possible and prevent it from progressing worse? Or if I'm already in the dementia stages, where can I put my, or what services can I provide for my family member to make sure that they're safe and they're well taken care of and they're going to be in an environment where I know everything's going to be okay. So that's, it is scary. Having a dementia diagnosis is definitely a scary thing, but like Alice said, we're going to be here for them and we're going to provide as many resources as possible to make sure that throughout that diagnosis and throughout that process, they feel like, okay, I know what I'm going to do now and I know what the next steps are now because it is overwhelming. And so having someone to help guide you and just have those resources there to say, okay, this is what we're going to do, this is the plan, this is the treatment that we have, planned out for you is a relief, really.
Right.
And it just makes you feel empowered to know, okay, this is what's going to happen. It's a terrible thing, or it's very scary, but I know what I'm going to do moving forward.
Absolutely. And I can speak to the early intervention piece. I think bringing that up is fantastic because we all like to, not see the weeds. We don't want to see the weeds. We only see the flowers. But
Mhm.
if we really address these issues and we are proactive, I have really seen a difference from those patients that we have on caseload, at least, with gait mechanics and have gone through FAU Memory and Wellness Center, gotten the proper diagnosis, gotten the right resources, and it takes a village. So it's not just about our programs, Brain Boost and our physical therapy and our memory and motion. That's just one little cog in the wheel of what is needed. But those patients that receive proper diagnoses in the beginning, get the proper early intervention programs, get the proper resources on board. I have seen what was told to us decades ago could not happen. That
Mhm.
although there is no cure, we know this, but if there
Mhm.
is a diagnosis there of dementia or Alzheimer's disease, it does seem to really radically reduce the rate of progression of this illness and in ways that we never thought possible. So, if nothing else, this is exactly why we need to get the testing done, get the
Mhm.
support done, and FAU Memory and Wellness is a one-stop shop to get all of that. Even if you don't do all of the other pieces, you have the community partners that will, and you can get people to them.
Mhm.
Yep, absolutely.
Absolutely.
Yeah. And it is, I mean, like Dr. Gomez said, it's a very scary process. It's a very vulnerable process, but you know, like you said, research has just shown time and time again that early detection and can slow it down. And then ultimately we really have to think about what is our goal, and our goal is for the highest quality of life possible for ourselves
Mhm.
and our loved ones. And really being proactive is the best way that you're going to be able to obtain, maintaining a high quality of life and continuing to do the things that you love, whether
Mhm.
it's through your work, through your volunteering, spending time with your grandchildren, spending time with your kids. It's really important to keep you engaged with your community for as long as possible.
Mhm.
Hmm.
Absolutely, 100%.
Yeah.
Well, Dr. Brumley and Dr. Gomez, thank you so much. I have so much appreciation and gratitude for the changes that you are making. It has been an incredible journey working with FAU Memory and Wellness Center. I have seen you guys really just take hold of this field and run with it. And I can just thank you from the bottom of my heart that I see that change in the caregivers and the support that is received in the early interventions that are being managed in the community so people can live at home longer and with better quality of life. Thank you so much.
Thank you.
Thank
We
you.
really appreciate the ongoing partnership as well.
Yeah.
My pleasure. Have a wonderful day. Take care.
Thank
Thank
you.
you.